I'm delighted to welcome Jim and Jean to the podium, and I'd like to read their award, lest I forget one important word. In recognition and appreciation of your civic leadership, visions, and pioneering spirits in the establishment and advancement of community health centers and the education and training of community health workers, as part of your commitments to the provision of quality and affordable health care to the people of the Commonwealth in or close to their neighborhoods. We applaud you.
Wow. Yeah, Hooley's saying something good about you. I must owe him money, you know? Loretta McLaughlin, who was our volunteer because Bernie told her to help the league, thank you for being here. My dear friend Mary Lou Sutters and Steve Kadish for all the work you do. Dana, Patricia, Joan, congratulations on your awards. Steve, for all the work you've done. Dan and Jim, just as we wrote it, thank you so much. And Andrew, my friend and colleague, congratulations on your work, Andrew, and it's my privilege to serve with Andrew on the Blue Cross Blue Shield Foundation Board of Massachusetts, and we've worked on so many projects together. Thank you. My dear friend Matt Fishman, who I can never thank you enough for all your friendship. So first, let Jean and I thank Bernie and Timmy and the board of MAMH and all those who dedicate their careers to caring for and maintaining the highest quality of life for those who suffer from diseases of the brain, both physical and emotional. What can I say to echo everything that's been said about MAMH for all these years? Thank you so much. Thank you for being there for us. How many times have most of us in this room called MAMH for advice, an intervention? Bernie or Tim, this young person needs to get into care. How do I get benefits for this family? Kadish, take notes on this. Can you give this agency some help? Can you call them and help this desperate individual access a system? Bernie always responds, always is thoughtful, and usually says, let me help. Let me see what I can do. So last night, because I knew Jack Craddock, our dear friend from East Boston, wasn't going to be here tonight. My dear friends from East Boston, some of them are here. He called me and he said, tell Bernie I'm mad at him. I can't be there. I want to be there. Anna and my mother went to the Mission Church every Wednesday for the novena. And when I needed novena, I called Bernie. And I said, well, what would you call Bernie tonight? He said, I would call Bernie and Tim miracle workers. Thank you. So in public policy, MAMH has always been an effective advocate and seldom in the spotlight, except the one time our collective advocacy between the League and Bernie landed us on the front page of the Globe. Do you remember that, Bernie? You're like, we're not going to talk about that tonight. But it's really important to recognize that Bernie is one of the few people in association management in Massachusetts who can say he's been around longer than me. It's that hard to fathom. The World Health Organization, in its 1948 Constitution, defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. My own mother, Grace, often said, without your health, you have nothing. She struggled for over 50 years with mental illness, but through the miracles of neuroscience, pharmacology, family, and extraordinary caregivers, was able to return to the community where she lived a productive life and a quality of life for the rest of her life. So this association and its work is very important to us. Both Jean and I came from families deep and strong commitments to service and social justice. Our beginnings were in Mission Hill for Jean, like Bernie, and myself in Dorchester. But like all Boston Irish identified by parishes, Mission Church and St. Anne's. My three boys here tonight, Jimmy, Peter, and Daniel, all are St. Anne's children and products of Dorchester. As Dan said, Jean graduated from Northeastern University College of Nursing and received a Kellogg Fellowship, earning a Master's in Public Health from the BU School of Public Health, and received her MSN from Northeastern. She's the educated one in the family. With upward mobility, I suggested that we move to Dorchester. As our 4 children arrived, Jean became engaged with clergy, providers, and local mothers, outraged that there were no primary care physicians in Dorchester, and they were encouraged by a new Office of Economic Opportunity grant that was given to Columbia Point. It was called the Research and Demonstration Grant. They organized the health committee, as Dan said, and the rest is history. Today, we celebrate the 50th anniversary of Columbia Point. As Jim said, over 900,000 people served in Massachusetts, and as Dan and my dear friend Jim Luisi from our National Association observed, we are now seeing 23 million people across this country and over 3,000. So it all started with Jean. Jean has become known as a woman of letters, penning her infamous notes, providing positive encouragement to people in need. In recent years, after her retirement from Mass General, she's been active in assisting grieving families in their bereavement and as a volunteer in church and local community. And I will add, she's also a Boston by foot docent, if anyone needs a tour of the dark side, the north end, or if you will, the Freedom Trail. Most recently, due to work in the community and on these projects, she was recognized, and we're very proud that she received from Cardinal Sean O'Malley the Bishop Sheriff's Medal, and we are very proud of that in our dear friend Jim Brett, who was here earlier tonight, would say that to know Jean Hunt is to know another member of the family. One of her favorite phrases to ward off anything negative is, "You have to apply the 3 F's. Don't worry." Jean would always say, if you can't fight and you can't flee, you have to flow. That's Jean's motto, and that's how she lives her life. Mine is a little simpler. It's taken from Robert Frost in the famous poem, "The best way out is through." So go head on. So as our friends have said, following Jean into healthcare was a natural fit for me. I was interested in civic engagement. I wanted to be, if you will, the President of the United States, and instead encouraged by Jean to paint the wall constantly. And it's been an exciting journey, 38 years of opportunity to serve those most in need of our services, diverse communities locally and nationally. Bernie and I have teamed up so many times on projects. It is just wonderful. So as I was thinking about this last weekend, I don't know how many of you saw it, but there was a segment with John Keller with Jack Williams, the longtime Boston News TV anchor, and he was speaking about his passion for Wednesday's Child, and he was reflecting on the spectrum of the lack of respect for the mental health system, for caregivers, for their overwork, for the professionals who work so hard that Mary Lou led in her work, and so many others have supported, and as Andrew has said, need to be supported further. And he used that bully pulpit of that little interview that he did as a person to basically promote the cause for mental health, and that's what Bernie and the League and so many advocates for primary care have done over the course of our careers, and what makes MAMH a game changer like the League too. So this award becomes very special to us, not only because Bernie is our friend and our colleague, but all of you and the work that you do is so important to us. The synergy between community health and mental health, the future integration that Mary Lou envisions, the kind of challenges Andrew puts forward are all very important, and we, Jean and I, respect and thank you for this recognition.